Okay. To introduce myself, my name is Jason Sork. I am a student of the McKendree BSN Bachelorette program. I'm also an employee of the Marion VA Community Living Center. And the purpose of this presentation is just to explain chronic diseases, chronic meaning that they're very long-term. It's not like an acute disease or acute infection like you have a strep throat infection where you are sick for maybe 5-10 days, get antibiotics and you recover. These are more or less for life, unfortunately. And two that we're going to discuss today are diabetes and chronic kidney disease. Now what's unique about these, if you'll look up here at our poster board, I've got diabetes and the causes of chronic kidney diseases kind of connected because they're linked together. Looking at the graph, you can see that the causes of chronic kidney disease, 42% are caused by type 2 diabetes. So what we're looking at is, we've got two diseases here, but they are connected. So really the main focus today is what you can do to prevent getting either the full impact of diabetes and possibly chronic kidney disease, or what you can do if you have the diagnosis, what you can do to live a healthy lifestyle. And some goals that we would like you to have today is what you can do about living a more productive life, like eating healthier, identifying risk factors, what can make you prone to get this, and also assessing community resources. Speaking of community resources, we're here at the Rural King VA Annex buildings, and when I was thinking about that, I was thinking about the resources that the VA offers. One thing that they do offer, if you're a veteran, is they have the My Health Vet program, the Veterans Health Library Encyclopedia, and may I add, I didn't realize how many resources that they have. They've got everything from A to Z and all in between. They have outpatient settings where you can have nutrition education clinics. We have a slew of resources of dietitians. We have also a weight management health program called MOVE. And you'll find out more as I discuss in further detail regarding some of the risk factors, why these are important, or some people would say imperative for us to learn. And finally, they have diabetic support groups that meet the second Thursday of each month at the Marion VA Hospital and the Evansville, Indiana Clinic. You might ask, well, what if you're not a veteran? Well, like in my area where I live in Gallatin County, we have the Egyptian Health Department, which have resources, support for diabetics, support for people with chronic kidney disease, Farrell Hospital in El Dorado, Harrisburg Medical Center, Heartland Regional Center here in Marion. They all have programs that a person can utilize in order to help get educated. Now, before I continue, right down here, I've got knowledge is power, and I'm sure everybody remembers Schoolhouse Rock. Well, the more knowledgeable you know about this, the better you are to prevent it from happening. So, does anybody have any questions of what you think diabetes or chronic kidney disease might be? Okay. Basically, before we begin about diabetes, let's talk about food, glucose in the body. Now, when you look at glucose, glucose is a sugar. And just like a vehicle, you've got to have gasoline to run the vehicle. Well, glucose helps your body to run. Okay, glucose comes from food that contains carbohydrates that's more or less like starches, sugar, rice, pasta. You eat it up, the stomach, the intestines, it starts digesting, and then it starts in breaking down the food to glucose, blood sugar. It enters your bloodstream, and then it carries the sugar to the muscles and the brain. So it energizes the body. You're like the Energizer Bunny. Keep going and going. But, unfortunately, we have problems where we don't keep going on and on and on like we'd like to. So that's where diabetes comes in. And what it is, it's like a disease, or it is a disease I should say, where it affects our blood sugar levels. Now it can do it in many different forms and fashions. One way it can do it is it affects the pancreas. That is an organ next to your liver, and what pancreas does, it produces a hormone called insulin. And the insulin, it more or less balances out your blood sugar. But what happens with diabetes, it will affect the pancreas where you can maybe not have any insulin produced. But what happens, you have what's called type 1. And as you can see, we have more or less somebody that bit the dust here with the X's. But this is a severe case of diabetes. It's usually called, like I said, type 1 diabetes. It occurs suddenly. Occurs mainly in younger children. You're usually diagnosed early in life. I have some cousins that have this type of diabetic disorder. And usually, because you can't produce any insulin, you have to be treated with like an insulin pump or insulin injections. Now, on the other side of the coin, diabetes can affect you where the pancreas is producing enough insulin, but unfortunately, it's not getting the insulin to the cells like it should. Or it's getting to the place like you're not able to use the insulin like you want, like you're getting a resistance to it. I'm sure everybody's heard of antibiotic resistance, where the doctors now in the media are saying you take something and your body's resisting. That's something similar. It's like your body's resisting this, which ends up with type 2, less insulin or insulin resistance. And it's about 95%. This is more common. This is what you see in a majority of your patients that are diagnosed with diabetes. Now, unfortunately, it's like a Pandora's box with diabetes. When you catch it, it can cause a lot of problems. As I stated, it affects the blood sugar. It affects the way your body's energized. Blood goes from the brain all the way to the feet. So you're talking about it can affect you in a cardiovascular way. You can end up having a heart attack. You might say, well, how can that happen? Well, usually what happens is with the buildup of blood sugar is you got arteries. It's kind of like a bypass or a road construction or infrastructure, whatever you want to call it. And what happens is you get a buildup of plaque that starts to occur. Well, you get a buildup of plaque and your blood is just still trying to push all of that through. Guess what happens? You have plaque, it'll break off, and it might end up in the brain. You might have a stroke. End up in the heart, have a heart attack. It can affect the kidneys, which I stated, you've got a connection here. And really, not to jump the gun, but like kidney damage. And this goes on hand with chronic kidney disease. What pretty well chronic kidney disease is in simple terms is your kidneys are a filter. And how many times have you had a vent and it gets clogged up? Well, it's not running properly, so you got to clean it up. Well, unfortunately, with our kidneys, you can't very well do that on working on the kidneys, because once they get damaged, you've got problems. But what ends up happening is, like that filter, it gets more or less clogged up. The kidneys, it cannot filter the waste out of your blood. So what happens? You have a buildup of toxins or pollutions in your blood. You get sick, you get infections, and ultimately you could die from it. So you can see how severe this is. Now, going on, what are you looking for? Or should I say, what are you at risk for? Okay. A lot of people, they think, well, a diabetic would have weight problems, overweight. Now, does anybody know why being overweight would cause a problem having diabetes? Okay. It's okay, it's okay. Basically, being overweight affects your body till you're not making and using insulin properly, and can cause high blood pressure. High blood pressure, what that means is the pressure in your body trying to maneuver that blood through to all the right organs, you've got more and more pressure, so you end up building up more chances of more and more plaque. High cholesterol is also a risk. Cholesterol builds up plaque. And you can see where this all kind of like, it's like a woven, a piece of wool that intertwines. They're all connected together somehow, some way. Family history. Like we always go to the doctor and the family will ask you, do you have diabetes, or does anyone have kidney problems or cancer or anything like that? Well, if you have a family history, you're prone to might get it. I know my mom's worried to death because her mom not only had diabetes, but her kidneys failed. So she's making sure that she is not severely at risk, or she's not diagnosed yet. The older we get, the more prone we are getting it. Unfortunately, we haven't found a medication to reverse age yet. So I'm afraid that all of us are more prone to catching it. A minority, African American, Hispanic, Latino, Asian. I found it very interesting that American Indians are prone to catching diabetes. You're less active. You exercise less than 3 times a week, and I know the older we get, the less active we get. But when I'm talking about active, I'm talking about mainly, do you get up, do you move, do you do different things? And how many people do we know of they retire, and then all of a sudden you find out their body just starts shutting down? What happens? They're not as active. They had that routine. And I have found many doctors stating that if you want to stay healthy and fit, like for example myself working at the CLC, the Community Living Center, I have to burn out more calories than what I'm actually burning at the CLC, meaning I try to be active in my non-work hours, which is hard at this time. Okay, and basically having pre-diabetes, and what that means is you don't have diabetes yet, but you're getting to that realm where you can catch it. Your blood sugars are not reaching that point of no return, but it's getting elevated, and the doctor's saying we need to watch you here. Now, on treating type 2 diabetes, I want to let you know that most of the time, healthy eating, healthy lifestyles helps prevent the full impact of type 2. Sometimes you have to take oral medications. Then sometimes you have to take insulin injections, but less chance of having an insulin pump like you would with type 1. Okay, now basically what we're looking at on what to look for, we need to have good resources to use. And I used some from the Annals of Internal Medicine, the Journal of the American Association of Nurse Practitioners, the Nephrology Nursing Journal, the VA website, the Centers for Disease Control and Prevention website, Healthy People 2020. And that is a nationwide program that we've had out that helps promote healthier lifestyles. Okay, let's go on and talk about what to look for. With the blood sugar, you can either have high or low. High, you're thinking about you're feeling thirsty. You got to remember you're using up a lot of energy. You know, the blood sugar is really getting up. This is talking about like 300, 400, even higher than that. You have to need to go to the toilet to urinate. Well, unfortunately, I have a weak bladder, so I hope I don't qualify for that. Feeling lethargic. You get tired. You're using up energy left and right. You have blurred vision. The blood, you know, here you are, your energy's going up and up. It can affect the nerves in your system. So, you know, your vision might get a little bit blurred. You have headaches. Because you got to remember, you're talking about all the organs in your body that are affected. Diabetes affects all the organs. Now, it might affect some individuals in one particular place more than others. And I'll get to that in just a minute. You might get prone for more infections. A lot of times I've seen people that have a normal sinus problem, and all of a sudden they got problems with their blood sugar. And they'll ask me, well, why? And it's the infection. The body, it's like fighting a two-way front war. Here you are, your body's saying, I got to fight these diabetes, but now I got to move the troops and fight this where the blood sugar's rising. So it's having a hard time balancing out. On the flip side, we've got low blood sugar, okay? Sweating, nausea, confusion. See, what's happening is your blood sugar is just dropping and you don't have much energy in the body. What happens? You start getting like the shakes, you start getting anxious, and your heart starts beating that much faster because it's thinking, hey, the body's shutting down. I got to do something right now. Well, you think about it. You got diabetes. You've got that blood trying to push through. Your blood pressure's probably going up. Your heart's beating up that much faster. Guess what might happen? It might stop. So, and that's where you see some people, when the blood sugar gets that low, they get in what's called a diabetic coma, where they're unresponsive and they have to do immediate care. So, to jump ahead, what can you do? Okay, if you're starting to feel symptoms of high blood sugar, you check your blood sugar. Now, when you see the doctor, when the doctor diagnoses you with diabetes, usually what they do is they give you a glucometer. That's a machine to check your blood sugar. You have lancets, little needles like, and I know they've got it on television where you can check any parts of the body now, but still yet there are some facilities they'll give you what I would call the traditional type. Poke your finger, get a good drop of blood. You have a strip that you put on the end of that glucometer. You check it, it'll suck that blood right out. And what I like to, I want to add is, used to the real older machines, you had to really get a lot of blood. Now you don't have to get as much. But it'll read that blood sugar. Okay, so you're checking your blood sugar, you're saying, oh, okay, 445, that's high. Blood sugar normally shouldn't be, it ranges different with individuals, but usually they say when you start getting above 120 and getting higher, then you're getting in the warning signs, especially when you get in the 140s. But every individual is a little bit different, but you've got to have a happy medium, so to speak. Okay, what do? Well, you drink water. I remember at a former job, we had this lady that had high blood sugars, and the doctor said, drink water. And what it does, it hydrates the body. It helps filter the body. It helps to eliminate waste, if possible, and the hydrations actually help to balance the blood sugar. Some people, they might not want to drink water, so what they'll drink is a sugar-free liquid. And that's fine too, as long as you stay hydrated. Okay? Check your blood sugar every 4 hours. If after 2 checks your blood sugar is still real high, you need to call your doctor. Reason being is, the longer this goes, the more pressure on your body, guess what? You can have some worse complications. On the flip side, what if you have low blood sugar? Well, if you start developing these symptoms, you check your blood sugar, eat or drink, it says 15 grams of fast-acting sugar. Really what it is you're eating something where your body will receive that sugar real fast, and you'll wind up kind of getting a little pep up, so to speak, and it'll maintain. It says, like a half cup of fruit juice or 3 or 4 glucose tablets. Sometimes the doctor will order you tablets where you can take. I've seen people use peanut butter, like a cup of peanut butter. My grandmother, for one, she'd have a jar of peanut butter right by her bedside all the time. And that's something to look forward to. If you have diabetes, you want to make sure that you've got some resources there to help you out. But let's say, okay, you check your blood sugar and you want to check it every 15 minutes. The reason why is low blood sugar is harder to elevate than high blood sugar is to lower. And it's strange on doing that. I think the theory behind that is it is harder to produce more energy than it is to lower your energy down. Now, that's just a theory. But if it remains low, let's say you check it 15 minutes and it's still low, eat that fast-acting sugar again. Let's say it's still low again, you need to call your doctor. Or ER, wherever, if it's like on the weekend you can't reach your doctor. Now here's something that's important. Once sugar is elevated, eat a small snack if your next planned meal is going to be beyond 30 minutes. The reason being is, you want to not only raise that blood sugar, but you want to maintain it. A lot of times I've seen people with diabetes, their blood sugar will start rising, and then all of a sudden you're watching them and then it starts dropping again. That's why you want to kind of keep a happy medium, keep it balanced. Now, what a lot of people don't realize though, with diabetes, this affects your lifestyle. So you need to adjust. You need to adjust how you live. It doesn't mean you're an invalid, meaning that you're shoved away in a patient's room and you're never to be seen again. No. What you got to do is you got to balance how you eat, how you work out. And when I say work out, I'm not talking about going to like the nearest recreational center like the Hub and getting on a Stairmaster or a bicycle. I'm talking about you're pacing yourself. Actually, what they recommend is when you start to try to build your immune system, start to strengthen yourself up, to go at it gradually, maybe for about 10 minutes, start out if you don't do anything. How many people do we know of when they want to lose weight and work out, they'll kill themselves day one? Well, you don't need to do that, especially if you've got diabetes, and definitely if you've got chronic kidney problems. Okay, you gradually go at it, 10 minutes, you do it for several days until you build that stamina up and then increase it to 30 minutes. Okay, you go out to the grocery store and you're thinking, well, what do I need to eat? Well, you want to have a balance. You want to, like, okay, on meats, you want to eat lean meat and poultry. And you want to bake it, broil it, or grill it. Frying it causes some grease. Well, I should say it does cause a lot of grease, which ends up causing an increase in your saturated fats. You end up getting a greater chance for cholesterol. So you got to watch how you're eating meats. It also recommends to cut the fat off the meat before you cook it. Vegetables. We all like to talk about eating vegetables, but the main one that I like to talk about is the dark green vegetables, and that's got the nutrients in it that helps balance your blood sugar even more. Fruits and vegetables is like the chateau of all things for diabetic. It helps good fruits, vegetables, and it's talking about you can have a variety. And actually, I've got a copy, a pamphlet, so to speak, and what it is, it's about small steps for eating healthy foods, and on the front page here, it talks in real simple terms, because if you're like me, sometimes I'll talk to a doctor or something, and they might tell me something, I'm thinking, what did you say? For example, a portion size. A half a cup of cooked rice or pasta. Same size and it's an ice cream scoop. Or 1.5 ounces of low-fat cheese, 4 dice. 3 ounces of lean meat or fish. A deck of cards or a cassette tape. I guess whoever made this was thinking of gambling. 2 tablespoons of low-fat peanut butter. A ping pong ball. Basically, what you're doing is you're eating decent portions, not overeating, but not undereating. Many times they recommend to divide the meals more frequent throughout the day. I know traditionally we like 3 meals a day. A lot of times they like to say it's better to divide it in maybe 5 meals, small portions a day. But it's pretty well what your body tolerates. I know as long as you maintain good nourishment and stuff, that is the main thing. Now, the other copy I made was getting active and keep track of important information. Now, this is important for all of us. Okay, let's go to the next one. Keep track of important information. Exams, tests, and immunizations. Okay, your doctor diagnoses you with diabetes. What he will do is he will check your, it's not on here, but I want to add, he'll check your blood and he'll check your urine. The blood he checks is for what they call glomerular filtration rate. And what that does is it just pretty well checks to see how your kidneys are functioning. And the urine he checks for a protein called albumin, and that's checking to see if your kidneys are damaged. So actually, when you're diagnosed and they're checking that, they're actually doing both at the same time, checking your kidneys and your blood sugar. But here it's got A1C, and that's pretty well checking your average blood sugar for like the last 2-3 months. And this is good for the doctor to know. He'll check blood lipids, which is checking your cholesterol, usually once a year. Blood pressure every visit, because high blood pressure, increased risk. And you want to keep up with your immunizations because, like I said, your body's fighting a two-front war. Okay, Getting active, mainly sticking with it, keep activities simple, and make the activity fun. In other words, don't try to go to a elliptica, so to speak, but just try, simple walking around the yard, or walking the dog, or when you're at work, parking maybe an extra block. Just those extra steps helps you out. Okay, now continuing on. Kidney disease. It's a condition, like I said, in which your kidneys are damaged and cannot filter blood as well as healthy kidneys. Because of this, wasteful blood remains in the body and may cause other health problems. Now, the problem with this is, and this is why it's good to be checked up with the doctor, you don't feel anything at first. How many people have had, for example, a disease like cancer, and all of a sudden they get a twinge, and they go to the doctor, and the doctor said, I'm sorry, you got metastatic cancer, and it's all over the body, and you never felt anything. This is why it's good to have routine checkups. Okay, the only way to find out for sure is through specific blood and urine tests, which we already went over. Now, if you don't have treatment, unfortunately, diseased kidneys will just eventually stop functioning, they'll stop working, and what ends up happening, you have to be on what's called dialysis, and that is a machine that you have that helps filter the blood. Believe me, basically what we want is where you understand where you don't get to that place. Now, I will state this, there are times where no matter what you do, you can end up like that because of health conditions and stuff. But the main thing of it is try to prolong it if possible. If, like you were saying, if you were told that if I did this, I could have had chronic kidney disease 2 years from now, but it'll push it back 5 years. Well, you're thinking you got 3 extra years where you don't have to worry about that. So, and by that time, you never know, they might have treatments that might even work better than what we've got now. Okay, it's very common, the risk. Diabetes, high blood pressure, you have a greater chance of it. Approximately 1 of 3 adults with diabetes and 1 of 5 adults with high blood pressure have chronic kidney disease or CKD. So, what do? You talk to your doctor, and he will state you need to watch your medications, because you got to remember your kidneys aren't filtering correctly. So you need to read your labels. On the back, and I know this is not medications, but for example, let me get it out here for a second. I've got breath savers. On the back, you've got usually ingredients. Well, like you have a bottle of ibuprofen or Tylenol, you'll look on the back and you'll be reading this. And usually they have something down if you've got to watch how much you take, or you need to consult your doctor if you have kidney problems. What you want to do, you want to talk with your doctor, engage your doctor, ask him about things. Can I take this, or do I need to reduce what I take? He'll also want you to do routine tests to make sure your kidneys are not deteriorating anymore. You want to eat a healthy diet like you would with diabetes. Pretty well, simply, when you treat diabetes, you're also treating chronic kidney disease. I know these are 2 different diseases, but you're actually working at the same goal. And he might recommend you to see a nephrologist, which is a specialist. But I will say this, a lot of people worry about costs. The most effective way to prevent high financial costs from this is prevention measures from word go. You're taking care of yourself, and that helps prevent the outcomes where you might have to be hospitalized. Can't even spit it out right. Okay, what helps? Screening. If you're at risk, you need to be screened. If you have a history of diabetes, blood sugar, and we'll just add cardiovascular disease like heart problems, or a family history. And I will conclude with this: keeping your kidneys healthy by controlling your blood sugar and blood pressure. In other words, when you balance your blood sugar, and I guess you can say balance your blood pressure, you're helping the blood where it's not really straining to get through to the organs, and it's also working where you're not having to build up a plaque. Routine checkups, eat healthy, and stay active. Now, before we close, does anybody have any questions they want to ask? Or did you have any feedback, or did anybody?
How many days a week should you follow a diabetic diet?
A diabetic diet?
Mm-hmm.
Once you are on it, the doctor would say to stay on it. And the reason why is you have to maintain a certain amount of calories. And that's a good question. What if you eat out? You go out to a restaurant and sometimes they don't have a diabetic diet. The recommendations is that you would not eat as much as you normally would. Like if, let's say it's a cheeseburger, you would eat half of the cheeseburger. If they have only sodas, you would drink a diet soda. You're pretty well trying to just modify your diet with common sense as much as possible. But the recommendations are that you don't do it all the time, but a diabetic diet routinely, and then watching yourself when you're out to eat. Anything else? Yes?
I've heard about the test, the hemoglobin A1C. What kind of numbers would you recommend with that?
Okay, I think I put that on there. I know they recommended 2 times a year, and I have got that written down because it, unfortunately, has escaped my memory. Imagine that. I have that actually written down here, and that is a good question to ask. Let me find it here, because I made sure to have the information down. Does anybody else have any comments or any questions?
According to your handout, it looks like they want to check the A1Cs. That's at lab work for diabetes about every 3 to 6 months. So the 6 months would go along with twice a year.
Right. I'm trying to